Welcome everyone to today's presentation. Today we have Marilyn Leila Sampilo, PhD MD. Dr. Sampilo is a clinical psychologist who is specialized in integrated behavioral health and health disparities among minority population, and she received her PhD in clinical child psychology with an emphasis in pediatric psychology from the University of Kansas. Dr. Madeline is also part of our trainers, so we're really happy to have her here. I also want to say that she has extensive experience in the cultural adaptation of treatment and interventions for Hispanic and Latinx children and families, and in community engagement and advocacy for this target population. She is currently a psychologist in the Center for Pediatric Behavioral Health at Cleveland Clinic, leads the Center Health, Equity, and Social Justice Initiative, and is a consultant and training and on issues of diversity and cultural proficiency. So we're really happy to have you. Thank you. So since September 15 until October 15, we celebrate the Hispanic Heritage Month, promoting cultural responsive mental health services for Latino agricultural workers who bring food to our tables. So this was part of our campaign to celebrate agricultural workers that are Latinos. Also, today's presentation is culturally responsive programs and strategies to improve access and utilization of mental health services among the Hispanic Latinx community. And this presentation is co-sponsored by Ohio Latino Affairs Commission. And also we want to acknowledge that we try to use affirming, respectful, and recovery-oriented language in all our activities. Please do not reproduce or distribute this presentation for a fee without specific writing authorization from the MHTTC network. You can contact us. And also the recording is going to be on our YouTube channel. So again, welcome everyone, and thank you, Dr. Sampilo, to be here with us. I will let you with Ed Marie that she's gonna do that poll questions before we start with Dr. Sampilo.
Hello everyone, we're starting with our poll questions, and the first one reads: a cultural broker's primary role is as mediator. Please select true or false. We have 59% answering true and 41% answering false. Let's do the second one. Lay health worker can serve as a cultural broker. Select one of the following, true or false. We have 84% answering true and 16% answering false. And the last one. Cultural brokering confers benefit to patient, provider, and agency. True or false? We have 97% true and 3% false. Thank you, everyone. And now we have Dr. Sampilo.
Thank you so much, guys. I'm really excited to be here today to talk with you about this presentation. Just before we get started, I just want to go over learning objectives for today's presentation. As I sort of mentioned, we're going to really focus on behavioral and mental health disparities pre and post COVID, because I really don't think we can talk about behavioral and mental health disparities among the Hispanic and Latino population without actually talking a little bit about what the current environment is. We're going to talk about structural factors and systemic drivers that contribute to behavioral and mental health inequities, define cultural brokering and its role in addressing those disparities and promoting equity for the Hispanic and Latino population, and then describe cultural broker programs and strategies in Ohio. So I'm super excited today because I love talking about these issues. I love talking about this topic, but I also get to really do a cool thing today and sort of highlight some of the good work being done here in Ohio to try and address behavioral health disparities for our Hispanic and Latinx population. All right. So before I begin, just to let you guys know, I have no conflicts to disclose. We're really going to start with the COVID-19 disparities among the Hispanic and Latino population. And I know this presentation, again, is focused on behavioral health and mental health, but again, I don't think we can really do that discussion service or justice without sort of talking about the larger disparity picture for Hispanic and Latinos currently. So this first figure depicts deaths and rates across states for the Hispanic and Latino population when it comes to COVID. But it interestingly depicts percentages of the share of deaths and cases across states in comparison to what you would expect for their population in that state. So basically what it's showing here on the left is that the Hispanic and Latinos represent a certain share of the death rate that is less than proportional in a lot of states compared to what you would expect given their overall representation in that state. But then in some states like New York, the District of Columbia, Virginia, Tennessee, you are seeing higher rates or Hispanic and Latinos representing a greater share of the death rate compared to what you would expect given their population. We also see for cases that Hispanic and Latinos are just testing positive at a rate higher than what you would expect in nearly every state. So in nearly every state, given the current Hispanic and Latino representation in their population, they're actually testing at a higher rate that you would expect. And so that suggests that we're seeing a disproportionate impact of the COVID-19 pandemic in terms of both infection rate, but then also in some states in terms of death rate as well. When we think about children, we're actually seeing even more stark differences. So this was a cross-sectional study at a pediatric community testing site for COVID-19. And basically what they found at this one particular community-based testing site is that their rates for infections were higher among Hispanic and Black children compared to white children in that geographical area. And again, the representation for Hispanics in the infection rate is a lot higher than what you would expect given their representation in the overall population. So again, just thinking about how many Hispanic and Latinos did we have in this geographic area, we would expect a certain number to test positive, but we're seeing a lot higher numbers testing positive. We also see the same disparities when it comes to hospitalization rates and death rates for COVID-19 pandemic. So when we look at hospitalization rates, and so hospitalization data for children gets sent to a population database, an overall population database, and the CDC reported that among the Hispanic and Black children that were hospitalized, their rates of hospitalization were nearly 8 times and 5 times higher than that of white children. And then sadly, in terms of deaths, there were 121 deaths reported to this population database and reported out by the CDC. Of the 121 deaths, 54 of those deaths were from Hispanic and Latino children, 35 were Black children, and then 17 were white children. So again, of the 121 deaths, 44.6% were Hispanic and Latino children, a much higher representation in death rate compared to what you would expect given Hispanic and Latino youth representation across the United States. So again, seeing some really stark disparities when it comes to morbidity and mortality with the Hispanic and Latino population. So that's just morbidity and mortality, which in of itself is concerning and something that we need to be attending to. But in addition to that, we're also seeing a disproportionate impact in terms of the behavioral health. We already have data to suggest that Hispanic and Latinos are reporting a higher rate of feeling like their lives have been majorly impacted or impacted in a major way by the pandemic. It's causing disruption. And so we're already seeing higher rates among our Hispanic population for behavioral health concerns. And then in a survey done by the Kaiser Family Foundation, we also see that Hispanic and Latinos are already reporting concern in terms of impact on their mental health. So not just has it been disrupted to your daily life, not just has it impacted your daily life, but is it having a negative impact specifically on your mental health? And Hispanic and Latinos are responding in a way that suggests that they are experiencing a higher impact. And then also, if they are experiencing an impact, they tend to report it more as a major impact compared to some of our other demographic groups. There are a lot of reasons for why this might be. One of the big contributing factors is the disproportionate impact financially and economically on Hispanic and Latinos from the coronavirus pandemic. We know that basically currently Hispanics and Latinos are disproportionately experiencing job disruption, loss of employment, as well as financial stress that's related. And just to give you a day-to-day sort of feeling regarding, what does that financial stress look like? In a survey done back in April, so early on in the pandemic, a survey was disseminated and asked, are you concerned about paying your cell phone bill or your broadband bill this month? And overwhelmingly, Hispanic and Latinos on that survey reported that they were concerned. And so think about that when it comes to how we're sort of utilizing telemedicine, telehealth, and even doing distance or virtual learning for our young Hispanic and Latinos. If you're concerned about paying your broadband bill or your cell phone bill, that's that stress, those daily stressors, and that disruption that may cause to learning or healthcare or receiving healthcare is likely to also impact your mental or behavioral health. So why are we seeing these mental and behavioral health disparities in the midst of the COVID-19 pandemic for Hispanic and Latinos? We've already talked about the disproportionate burden from a mortality and morbidity standpoint. We've also just talked a little bit about daily stress associated with COVID-19, the financial stress, job-related stress, and even school stress related. But there's also some other contributing factors. We have barriers to implementation of recommendations. So a lot of our Hispanic and Latinos live in densely populated areas. That makes social distancing more difficult. They also may live in multi-generational households, which also contributes to difficulties in terms of social distancing. They may also not be able to stay home when they're sick due to lack of paid leave or due to not having options to telework. A lot of our Hispanic and Latinos are low-wage workers or are essential workers and may lack some of those teleworking options. There's also concerns with racism, discrimination, and xenophobia in the current socio-political climate, as well as just some policy that can impact things related to behavioral and mental health care. So, just as an example, thinking about concerns related to immigration policy and recent concerns regarding the public charge rule has caused some Hispanic and Latino families to not pursue public benefit programs like Medicaid, even though they might be eligible, for fear that that would somehow reflect negatively in terms of their status. And so without accessing things like Medicaid or other public benefit programs, individuals, Hispanic and Latino individuals, may not have access to insurance in order to then pursue mental and behavioral health care as needed. We also have structural barriers to services. So not only may there be, lack of access due to insurance, but there may be a lack of knowledge regarding available services. There may be difficulties accessing services due to transportation difficulties or not having services locally available. There may be long appointment times or long waits for appointment times, and there may be appointment times that don't coincide with one's work schedule and being unable to get your family members to those appointments. So there's some structural barriers there. There's also cultural factors related to help seeking and in terms of thinking about behavioral and mental health care and treatment. So there are cultural factors that are relevant and at play here as well. There's also concern about a lack of culturally and linguistically competent services. So there are behavioral health services that are available, but there may be some concern about cultural and linguistic competence of providers or the welcoming, inclusive nature of the agencies themselves. And there are also concerns with language access and accessibility. So not having adequate language resources, especially for our limited English proficient population among our Hispanic and Latino population, for those who prefer Spanish or those who primarily speak Spanish, not having interpreter services or not having consistent and reliable access to interpreter services can also be a contributor to those disparities. So that was all in the midst of COVID. This is actually data pre-COVID. So this data is from 2018 from SAMHSA. And basically what you're looking at here is a graph that depicts treatment need and then gaps in treatment across various substance use and behavioral health or mental health disorders. So this is primarily for adults, so just to sort of orient you to that. But basically you're looking at huge gaps. So the darker part of your bar graph here, the darker colors represent those in treatment, and then the total bar graph represents those who need treatment. So you see that the lighter proportion represents those not in treatment. That's a significant proportion of the individuals represented on this graph. So more than half in most instances are not in treatment despite treatment need. Again, this was in 2018, so this was pre-COVID-19 pandemic. Now superimpose the current pandemic, and these gaps are just widening. These gaps are getting larger, and there's a lot of concern regarding what are we doing to try and close the gap, or at least prevent these gaps from widening exponentially. So why pre-COVID did we have these inequities, if you will? Well, behavioral health inequities for Hispanic and Latinos are a result of a complex system of disparity, basically. And so we live in a complex system of disparities that perpetuates inequities, and those inequities then contribute to Hispanic and Latinos' inability to access mental health care or difficulties accessing mental health care. I'm not going to spend a lot of time on this particular figure, but I just kind of want to lay the groundwork for you here, which is basically we have inequities in policies. So we have racism, discrimination that is sometimes intentionally or unintentionally embedded into our policies. And those policies then manifest or are present in our various systems, including the healthcare system. And as a member of a minoritized or marginalized population, like our Hispanic and Latino population, you can experience minority stressors that then influence how you're able to access care and how you're able to sustain your mental health and mental wellness given your environment, your socioeconomic resources, your social mobility, and sort of navigating those structural barriers. So just think of this as sort of all interconnected layers of disparities or inequities that are generally a result of policies at its broadest level. So just briefly, how does this play out day to day? So what does this actually look like? How do we get from those structural inequities to inequitable health outcomes? Well, it's largely due to social determinants of health. So think of social determinants of health as the terrain or the playing field upon which structural inequities are enacted or manifest to then create inequitable health outcomes. So what does this more look like? This is sort of what it looks like day to day. I like this figure from the California Department of Public Health because it really sort of outlines some of those social determinants of health on the sides of the healthy people the triangle, if you will. And if you look to the upper left of this slide where it says prevention, mental health services, and culturally linguistically appropriate and competent services, those are all the things we're talking about today. Those are all the things that we're focused on in terms of thinking about how are we making sure that our Hispanic and Latino community is able to access behavioral health services in an equitable manner. If those things are not present, we really are not able to potentially support an individual's health, because as you see from this picture, an individual's health or a healthy person or a healthy individual really is a function of having a healthy community, having a healthy environment, and having a healthy society. And having access to prevention, mental health services, and having culturally and linguistically appropriate services is a part of creating that healthy environment. So without access to those things, or without things to close the gaps in those areas, an individual's health can be at risk, or it's harder to address concerns with an individual's health or their mental health. So what is one way that we can actually address these issues? Well, cultural brokering. So what is a cultural broker? There are various definitions of what a cultural broker is or what cultural brokering is. But for the most part, basically a cultural broker acts as a bridge or a link between persons or groups belonging to different cultural backgrounds. And they they act as that bridge or that link in order to facilitate a more effective interaction. So really just sort of think of it that way. That's sort of what it boils down to. And so why do we want to engage in cultural brokering, or why is this a practice or strategy that we should sort of adopt? Well, there's various reasons for it. We're gonna, on the left side, we're gonna talk about some very like logistical reasons, and then on the right side, we're gonna talk about cultural reasons for why we want to invest in cultural brokering. So first and foremost, we know that we are living in an increasingly diverse and multicultural society. So we have projected demographic trends of our increasing diversity within the US population. And so we have to be responsive to that diversity as a mental health and behavioral healthcare system. There's also emphasis on cultural and linguistic competence in healthcare organizations. There's something called the class standards, and that governs sort of cultural and linguistic competence for agencies who receive federal funding. And so there is an emphasis on this at an organizational level. And so cultural brokering can really kind of help promote cultural and linguistic competence. And we'll talk a little bit more about how they would do that later in the presentation. We acknowledge, and we just talked about, that there's current disparities in healthcare access, treatment, and outcomes. And we want to promote health equity or behavioral health equity for our minoritized or marginalized populations. From a cultural standpoint, we know that there's diverse belief systems related to health, healing, and wellness. We also know that there's diverse belief systems regarding perception of illness, disease, and their causes. And all of that applies to mental health as well. We know that there's cultural factors or cultural influences on help-seeking behavior and engagement with the healthcare system and with healthcare providers. And we know that there are populations that use indigenous or traditional healing practices, and being cognizant of those and how those interact with our traditional healthcare system. So these are all reasons for why cultural brokering is important. So who are cultural brokers? For the purposes of this presentation, because we're primarily talking about mental and behavioral health, I created this graph just to sort of illustrate who could be a cultural broker. Basically, in the mental health or behavioral healthcare system, it's really whoever works with the family or patient, with one caveat, which we'll get to in a second. But it could be a community member who comes along with the family to a healthcare encounter. It could be a lay health worker employed by the agency themselves. It could be the interpreter acting as the cultural broker, the provider or clinical staff, a therapist or a social worker. It can also be a peer supporter or a peer mentor. Really, it's anyone who works with the family or patient, provided that they fulfill one of specific roles, functions, or responsibilities, which we'll talk about now. So cultural brokers fulfill certain roles, functions, and responsibilities. So that's when I say like anyone can be a cultural broker. That is true, but it's as long as you're fulfilling one of these roles. So we'll start with sort of the left-hand side of the picture, which is liaison. So really, cultural brokers have knowledge, two sets of expert knowledge banks, if you will. The first is that they really are knowledgeable about their own culture and the community that they represent. So they come in with that level of expertise about their culture, their community, the needs and the strengths of their culture and their community. They also have effectively learned how to navigate a system, in this case, a healthcare or mental health care system. So they bring those two banks of knowledge and basically serve as a way to liaise between those two systems. They can also serve as a guide. As I mentioned, there's an emphasis on cultural and linguistic competence for healthcare. And so as agencies work to improve their cultural and linguistic competence, cultural brokers can really serve as a guide in terms of improving those practices and really trying to understand and help the agency really understand what are the strategies or what are the practices that the agency should adopt in order to work more effectively with their culture or that community. Because of their role in terms of understanding the needs of the community and culture, they also can advocate on behalf of patients and families. So they can advocate for resources or supports that are necessary to help support and improve that mental health or wellness of their community. They can also act as a mediator. So members of minoritized or marginalized populations often have a strong distrust of the healthcare system due to historical and contemporary issues. And so a cultural broker can really be critical in sort of building that trust and reestablishing that trust between a community and the healthcare system. And they can also be a catalyst for change. I think one of the things that we're really talking about it on a national level is creating systems that are more diverse, more equitable, and more inclusive, and promote belonging. And that is something that a cultural broker can definitely help in terms of a systems transformation perspective. So they can really help agencies or providers or systems really become more diverse, inclusive, and equitable in terms of what they see as gaps, in terms of what they see can be done to address those gaps, and again, sort of helping link the two domains, a community and then the system itself. So what are the benefits of cultural brokering? And before I get into this, just as an aside, cultural brokers can also function in other systems. So I know for the purposes of this presentation, we're really talking about the mental health care system, but cultural brokering can also be really effective in a school system, in the legal system, really in any system where someone from a diverse background is going to encounter sort of the majority population, and there's some difficulties navigating those cultural differences. A cultural broker can really be very effective. And again, anyone can really be a cultural broker, assuming that they fill one of the roles that we just discussed. But what are the benefits of cultural brokering? For the patient, it's to increase their engagement in the healthcare system, and not just engagement, but also retention. So sometimes we have members of underserved populations who enter the healthcare system, but due to a poor experience, due to lack of feeling like it was an effective interaction, or lack of feeling like it was effective in achieving the outcomes that they desired, they may not stay in that healthcare system. They may not return to the healthcare system. So we're also talking about retention as a benefit for patients. We're also talking about earlier intervention. The earlier that we can get individuals identified and involved in the healthcare system as needed, the more likely that we are able to prevent further morbidity and mortality. And when it comes to mental health care, if you think back to the SAMHSA bar graph that I showed, all of those individuals who are not currently in treatment but need treatment, likely some of those issues, for some individuals may resolve on their own. For other individuals, those mental health issues and substance use issues may worsen over time without appropriate care. So earlier intervention, in this case, is intended to prevent further negative outcomes. For the patient, it can also engender comfort and trust by working with a cultural broker in the system that they're interacting with. And it also can leverage or also can promote community impact. So a cultural broker may be working with one individual, one family in terms of navigating the healthcare system, but also that by virtue of that encounter is also serving as a model in some way for other community members. And so seeing how successful or effective an interaction may be, seeing that a cultural broker helps facilitate effective interactions, may lead to more individuals in the community engaging with the healthcare system, and by virtue of that, leads to a healthier community overall. For the provider and for the system, it allows providers and systems to really sort of get at prevention and health promotion. And so instead of necessarily treating the mental health issue when it's a little bit more severe, but being really able to prevent mental health concerns, or at least promote mental wellness and promote things to help sustain mental wellness can be one benefit of cultural brokering. It can improve service delivery. So when we think about that, we think about patient satisfaction. So working with a cultural broker for the system can improve patient satisfaction, can engender, again, patient trust, and sort of improve just overall service delivery for a minoritized or marginalized community. It can result in reduction of costs. So if we think about mental health care, earlier intervention may help promote or may help prevent use of costly services like emergency department utilization or things like that. So there can be a business case for using a cultural broker that in terms of reduction in costs as well. And then connection to a community. For an agency working with a underserved community, one thing that's really important is sustainability, that agency is able to sustain a good working relationship with that underserved community. And by using or working with a cultural broker, they can create that connection with the community, and potentially a more sustainable connection, whereby the community is more likely to engage with that healthcare system, is more likely to feel comfortable with that healthcare system. And again, from a financial standpoint, helps promote that agency's sustainability as well. So cultural brokering is really important, I think, when it comes to point of contact barriers. So when I say point of contact barriers, what I'm talking about are the barriers that one encounters when they're just entering or trying to enter the behavioral health system. So here are just some samples of, or some examples of these point of contact barriers. So sometimes when someone is in need of mental health or substance use services, they face barriers just even in initiating contact and engagement. Perhaps that's due to language, perhaps that's due to not knowing how to even establish contact or even remotely try and engage. They don't even know what they need to do to engage with the system. A cultural broker can assist with that. In terms of other point of contact barriers, insurance coverage are things that people from the beginning, if you're looking for behavioral health or mental health services, insurance coverage can be a barrier. Transportation can be a barrier. And then language accessibility or availability of interpretive services. So all of these are point of contact barriers, meaning if you don't address these barriers, you're likely not going to get any further in your process in terms of accessing the behavioral health care system. And so we really need systems or strategies in order to help address these barriers. And a lot of the strategies that we're going to talk about today are different types of cultural brokering programs. So we'll talk about the first one now. So as I mentioned at the very beginning of this presentation, I'm really excited because I get to highlight some really cool things that are happening in the state of Ohio. So what I want to highlight right now is the Ohio Latino Community Mental Health Navigator Program. It's a partnership between the Ohio Commission on Hispanic and Latino Affairs, which is our state's or Ohio State's premier sort of advocacy organization for the Hispanic and Latino community here in Ohio. And they partnered with the Ohio Department of Mental Health and Addiction Services to provide funding for a community mental health navigator program. And the point of this program was to address those point of contact barriers, to sort of, as this image on the left hand sort of depicts, is to sort of bust through those barriers so that those point of contact barriers aren't things that prevent individuals, Hispanic and Latino individuals, from engaging with mental and behavioral health care. So how this worked was we piloted a bilingual community mental health navigator program serving communities in Central and Southwest Ohio. So in Southwest Ohio, it was Su Casa, and in Central Ohio is Our Lady of Guadalupe Center. Technical assistance was provided by bilingual supportive agency in Northeast Ohio, which was El Centro. So I want to definitely give a shout out to them because they did a great job in terms of helping get these programs off the ground. And then in terms of what we expected from this pilot program, the expected product and outcomes were to establish this is a feasible service and then an acceptable service for the community. And again, I just really want to highlight both Su Casa and Our Lady of Guadalupe Center for really taking on this task and trying to pilot this community mental health navigator program to see how it would work and to really not only just see how it worked, but also identify barriers, identify issues to try and help strengthen the program moving forward. So the Ohio Latino Community Mental Health Navigators at both areas, they served as a bilingual central coordinating post. So there was a navigator, a mental health navigator, who served as sort of the central coordinating entity. What they did was they sort of identified individuals who needed behavioral health or mental health services, located resources for those individuals, and in terms of locating resources, determined what was needed in terms of insurance, in terms of transportation, in terms of distance, facilitated referrals to mental health agencies, and they also promoted engagement in overall, just in the behavioral health care system. What the navigator was particularly adept at doing was helping individuals who had mental health or substance use needs really understand the benefit of services for identified issues. So really trying to engender some trust and a comfort with engaging with the behavioral health care system. So that was a critical feature of what our navigators provided. And then they also provided client advocacy. So our navigators have identified issues that they've encountered in terms of referring individuals for behavioral health care, and they really have tried to advocate on behalf of patients and on behalf of the Hispanic and Latino community in general, in terms of making sure that we're doing the things that we need to do and making sure that we have the resources and supports in place in order to try and address these needs and have the capacity to address these needs. So outcomes, and these are outcomes that were reported by the two programs. And I also want to sort of highlight that there are other mental health navigator programs happening in Ohio. There's one in Toledo, which is a fantastic program as well. I'm just highlighting these two specifically because of my work with them, and then specifically just because of the nature of the pilot. So it was to develop a network of culturally sensitive mental health care resources. That was one of the outcomes. So what does that mean? Basically, that means identifying providers, agencies, entities who can provide culturally sensitive mental health care resources. So developing a network, but then also on some level developing like a resource bank. They would refer to internal and external programs that provide mental health care to families experiencing trauma. So one of our entities had some internal services that they could provide in terms of behavioral health care. One of the other agencies did not have that capacity, but were able to connect with some other outside or external programs or external agencies. And then they worked with external agencies to develop a continuum of care utilizing community mental health programs. So continuum of care meaning that not just mental and behavioral health care might have been needed, but they might have needed wraparound services. They might have needed other supports or other things to help sort of engender sort of their overall well-being. And so the mental health navigators worked in that capacity. They also worked to try and make sure that individuals felt comfortable with sort of the care plan. So if they were being referred to an external agency, the navigator would sort of ensure that the individual would get to that initial appointment and then provide any assistance afterwards in terms of navigating if needed. Other outcomes, they were able to coordinate and track care for Latinos or Spanish speakers. They were able to track and monitor resource gaps for Latinos or Spanish speakers, which I think is incredibly important because we're going to highlight some of the issues that caused. And then what they also did was empowered and educated their clients and their community about mental health. So overall, they fulfilled a variety of roles and they played a critical role in sort of helping promote mental health and behavioral health among the Hispanic and Latino community. And they also were able to sort of help individuals connect with resources and really enter the behavioral health care system while addressing some of those not addressing, but sort of removing some of those point of contact barriers to promote increased engagement and increased success. So the idea was that behavioral health needs would be identified. You would have the community mental health navigator there in the middle, and as a program that sort of engenders cultural brokering or is an example of cultural brokering, and then they would help people enter the behavioral health care system, right? So looks great, looks like a great model, looks like it would work seamlessly, but it doesn't. So not so fast. So gaps remain in the behavioral health care system. And I think it's important to highlight that. So the community mental health navigator was a fantastic pilot. I think they did fantastic work. And I really want to shout out those organizations. The thing that, however, they both encountered was that there is still a lack of language access when it comes to referrals or referrals for behavioral health and mental health. So even though you can get someone in the behavioral health care system, it's a challenge still to find an agency or a system that provides the consistent, reliable interpretive services or language access that's needed. They also found that for some agencies, there was a deficit or a lack of cultural proficiency. So, feeling like, the agencies just lacked, some aspects of cultural proficiency in terms of working effectively with the Hispanic and Latino population, which I know is an issue nationally. And then just lack of availability and accessibility. So even though they developed this network of providers, even though they identified some of the agencies, because they're limited in terms of bilingual providers, limited in terms of interpretive services, there was some concern about availability and accessibility. How much capacity would they have to help connect some of these individuals when maybe the behavioral health system, the infrastructure of the behavioral health care system itself is not quite ready for it. So with that said, they identified some gaps, and then now it's sort of, well, what do we then do to try and address this gap, right? So we have a gap in treatment need and treatment reception already. We have now a gap in terms of the infrastructure of the behavioral health care system. Now we need other cultural brokering strategies to sort of help fill that secondary gap. And this is where other types of cultural brokering programs come into play. The Promotores de Salud Mental model is actually a fantastic model, I think, of trying to bridge that gap. Basically, what you're talking about is bringing mental health and behavioral health into the community itself. So these are health workers who generally are Hispanic, who are members of Hispanic or Latinx communities. And we're sort of using this model as leveraging the effectiveness of community health workers in physical health and public health. That's where the Promotores model sort of initiated and evolved from there, was basically how do we help reduce chronic disease morbidity in the Hispanic and Latino population? It was to employ community health workers to go out into the communities themselves, provide some of that education regarding public health, chronic disease, provide some intervention and try and help bridge that gap for Hispanic and Latinos. The way that we sort of see it, evolving in terms of the mental health world is it would address current deficits in that mental health and behavioral health space. So we know that there's a workforce shortage in general for behavioral health and mental health. When we think about bilingual providers or providers who have, again, access to consistent, reliable interpretive services, culturally proficient providers and agencies, there may be some gaps and deficits in that space. And so this is one way to sort of address that gap by really bringing the mental health service into the community itself. So who are, promotores de salud mental, who do they serve and what would they do? Well, they're members of the communities that they serve. So they have that firsthand knowledge of community needs and resources, just like a cultural broker, like we talked about. That's one aspect of their cultural brokering. They work and provide services in the communities, and they typically receive specialized training in their areas of service. So if you're a community health worker or a promotora for diabetes, for example, you'd receive specialized training in diabetes education and intervention. In terms of mental health, you would receive specialized training in mental health education, and then mental health, like brief intervention and identification. Promotores de salud mental is a model that has been implemented in a lot of different states across the country. When we did when the authors did sort of a review of the current programming, they basically came up with 4 main functions that a promotora does in terms of the mental health. They educate, so they provide education in the community regarding behavioral health and mental health. They disseminate information, but then also disseminate some intervention material or interventions themselves. So there may be some messaging interventions, there may be some small scale interventions that a healthcare organization or a mental health organization would recommend, and the promotora goes out in the community and disseminates that messaging and disseminates that intervention. They also facilitate referrals. So similar to our mental health navigator, they may be able to identify individuals who need a higher level of care or higher level of behavioral health service and are able to facilitate their entry into the system. And then they also advocate for individuals who are having mental health concerns. So they're able to advocate on behalf of those individuals to agencies or advocate on behalf of the needs of the community from a mental health standpoint in general. So this is an example actually of a promotora de salud mental model. It's at Stark County here in Ohio, and Mr. Isaac Baez is sort of the lead on this, and I'm going to highlight his contact information in a second, just so people can contact him if they would like more information. But basically, this is a model of a cultural broker as ally. So the model there is called a cultural ally model, and it's again located at Stark County Mental Health Board and Addiction Recovery. It operates through them. The cultural ally, who in this way serves as a cultural broker, is responsible for connecting individuals or groups to needed services and supports. And one of their main goals is to help build community allies and encourage the community to support each other. So the individual not only works with individuals, but also works with the community at large to, again, sort of help encourage the community to promote mental wellness amongst themselves, and then promote strategies that helps promote mental wellness for community members individually. The Cultural Ally Program was deemed the Cultural Ally Program because they felt that it was more effective for the local community because it's easier to understand and translate into other languages. So instead of saying cultural broker, they sort of turned it Cultural Ally. The Cultural Ally really functions as a promotora de salud mental in this program in ways. It bridges the divide between mental health care settings and members of the African American, Latinx, and Mayan communities in Stark County. So they have a really robust program. And I actually spoke to Mr. Baez just the other day to kind of get an update and see how his program was going. And he mentioned that Christina, who is their cultural ally for the Hispanic and Latino community, Christina Zenon, is doing a fantastic job, and literally in the last several months has connected like 100 individuals to mental and behavioral health care that's been needed. And so I really think that their program is a really good model for how something like a cultural broker program can work and can work effectively. I provided Isaac's email, and I did get his permission for if people have questions and want to reach out to him specifically about sort of his conceptualization of this cultural ally program. Again, it's a cultural broker program, a little bit like a promotora de salud mental program, but it's got its own sort of nuances and things. And so, feel free to reach out to him. He's definitely willing and able to answer questions and interested. He's definitely super helpful. So that's one example, another example here in Ohio. Another thing that's happening here in Ohio is dissemination of mental health first aid. So mental health first aid is an international program. It actually, its genesis was in Australia, and it's a public education program. Basically trains lay individuals, so no one that needs, formal behavioral health or mental health training, but trains individuals to identify, understand, and respond to signs and symptoms of mental health and substance use concerns and distress. And the whole curriculum really focuses on recovery and resiliency. The idea is basically, again, it's about engendering skills in lay community members and everyday individuals to be able to better identify individuals who might be struggling with a mental health or substance use issue, identify, provide support, and then provide maybe some ways to help get them any additional assistance or support that they may need. So it provides guidance and training, but then I think one of the best things about mental health first aid is it provides this 5-step action plan. The acronym is ALGI, but it's basically an action plan to promote support and intervention. So an individual learns very concrete strategies or steps on if someone is experiencing a mental health issue, what is your role, what can you provide, and how can you help them in the moment. And it has demonstrated effectiveness with advocates who serve Latinx and Asian American immigrant communities. So there is some evidence to suggest that people who serve as mental health first aiders, if you will, so people who provide this service, advocates on behalf of the Latinx and Asian American immigrant communities, those advocates found that this curriculum was helpful in terms of their comfort, in terms of addressing mental health issues, in terms of their, not just comfort, but then also their confidence in terms of how do you intervene or how do you provide support in that moment. So it does have some evidence for diverse populations. What we are trying to do here in Ohio is utilize mental health first aid or have more individuals from diverse backgrounds become mental health first aiders. So really trying to diversify the representation in terms of the current mental health first aiders who are available in Ohio. And again, anyone can undertake this curriculum. It would be useful for teachers, it would be useful for community workers, would be useful for really anyone who wants more information or wants more training on mental health and working with diverse populations, or just working with any population really in mental health. This is a great curriculum. I am a psychologist by training, so I actually did this training just to sort of get an understanding of what lay individuals may receive in terms of training. And I thought that the curriculum actually worked really well in terms of giving some really brief, concrete action steps that one can take, and also gives you, I think, a comprehensive enough understanding of the different manifestations of behavioral health or substance use issues. The one thing that they are working on, and is something that they are actively working on, is to try and make this curriculum more inclusive, more culturally competent and culturally proficient. So that is something that is currently ongoing. This curriculum is available in Spanish, at least it was when it was being delivered in person. They are currently working on the virtual training in Spanish, and I think it's going to be released in a couple of months. But again, it's something that, definitely I think needs some enhancements when it comes to cultural proficiency, but is again a way or a program that can be helpful in terms of closing that, that workforce gap, if you will, by providing other individuals with some mental health first aid information and training. So if you're interested in, getting trained to be a mental health first aider, again, I know this is an initiative here in Ohio. There is a link here at the bottom of the slide that you can access to kind of sign up for virtual training. And mental health first aid is broken down into different curriculums for different age groups. So there is a general mental health first aid curriculum, and there's also a youth mental health first aid curriculum. And again, one of the things that we are trying to do is to recruit more diverse representation into the individuals who are trained as mental health first aiders. We want more people to be able to provide or have this training who look like the different populations that are represented throughout Ohio. So if you're interested, please, check out the website and maybe become a mental health first aider yourself. So when we think about all of the different programs we've just highlighted, there are some recommendations that really come to the forefront. One is that we really need to invest in building additional frontline capacity. So when I say frontline capacity, I mean the individuals who are going to provide mental health services, not just the providers like myself, the psychologists, the social workers, the counselors who work in the different agencies, but we're never necessarily going to have the behavioral health workforce to serve everyone. And so really trying to help bring behavioral health knowledge, skills, capacity to other community individuals, community members who can be part of that frontline workforce, if you will, can be part of that frontline service, if you will. And so really trying to build additional and innovative ways to build that frontline capacity. We need to expand the network of non-traditional mental health providers. So again, not necessarily people who have formal mental health training, but really need to expand the network and the capacity and reach of models like cultural broker models, promotores de salud mental models. So people who may not have traditional mental health education, may not be a traditional mental health provider, but certainly can provide mental health assistance and support and really serve a critical role. So I think we need to sort of recalibrate how we think about that, and then also sort of expand the network in terms of those types of providers. I would also argue that we need to really coordinate with health plans and improvement plans. So depending on what state you're in or what locale you're in, you may have like a community health plan or community improvement plan. And I think mental health is likely to be a piece of all of those plans. And so where do cultural brokering programs fit into those plans? Perhaps there's, a goal or objective in those plans that really would be best met if we had, cultural brokering programs or cultural brokers sort of infused into the systems. And so really trying to coordinate with those plans, because it does give you additional buy-in in terms of financial support and sustainability. And then what we've learned is that really we can't implement any new program without ongoing process monitoring and improvement and technical assistance. So anytime you launch a new innovative or different kind of program, there has to be some time to be able to process monitor, and see how things are working, make changes as needed, make changes and adapt in the moment and things like that. And so really trying to really think about program implementation, not just from we're going to pilot this program, but really we're going to pilot this program and sort of see how things are going and then make changes so that our program and our services is more effective. That's particularly important when we're serving underserved or marginalized populations, because we don't want to basically, waste resources. We want to make sure that what we're doing is working for that community. And so if in the implementation we're finding it's not working the way it's intended, being able to make those quick changes, being able to make those adjustments so that we're being more effective and being more we're being more effective in sort of the work and the programming that we're offering. So what did we specifically, learn from implementing the Community Mental Health Navigator programs? First thing was that there is incredible value in conducting an environmental scan. So whenever you're looking to connect individuals with the behavioral health system, it's important to know what specifically is available in your behavioral health care system. There may be assumptions that we make about the behavioral health care system. We may assume that every agency is culturally proficient. We may assume that every agency provides reliable and consistent interpretive services, but that may not necessarily be the case. And so really trying to conduct an environmental scan to understand what are the resources in your community, where are the resources in your community, and where can you send individuals who might need mental health and behavioral health care. Really think that part of that, conducting that environmental scan, is also coordinating with local mental health boards and behavioral health authorities. So mental health boards here in Ohio sort of operate as an important fulcrum in terms of the mental health system in their county or their area. And so really coordinating efforts with them, if you're going to implement a Community Mental Health Navigator program, to really sort of link, help understand the layout of mental health resources in that particular geographical area, and then also working with them in concert to making sure that the Community Mental Health Navigator is also functioning sort of in a way that's helpful to the board as well. So that is definitely a critical piece. And then we recognize that we really need to support sustainable lines of funding for programs like this. There is so much value in cultural brokering programs, but often they are grant dependent. And so really trying to work with different systems, different agencies, whether at the state, the local level, your local mental health board, but really trying to find sustainable lines of funding. So funding beyond just piloting the program, but really some sustainable lines of funding. The research is there, the evidence is there for these programs to be effective. There may be some hiccups in the startup, there may be some challenges, as we encountered, but the program itself is effective. These are effective ways to really enhance and improve engagement in the behavioral healthcare system for Hispanic and Latino population. So really trying to find lines of funding that will support it more long term. And then in terms of implementing community mental health promotores models, partnering with existing CBOs or MCBOs, so community-based organizations or minority community-based organizations. This is really important because I think sometimes one of the recommendations that we would make is that sometimes agencies may be really interested in sort of adopting a program, and they may be interested in sort of creating their own program. One of the things that we would encourage is to actually look to your community-based organizations or your minority community-based organizations, because they likely are already providing the service in some way that's informal. So prior to implementing the Community Mental Health Navigator program at Su Casa and Our Lady of Guadalupe Center, they were already trying to do case management around individuals that they served who needed mental health services, who were identified as needing mental health services. So informally, they were already sort of doing some of the work of a community mental health navigator. And so we would really encourage you to partner or at least communicate with some of your local community-based organizations. They're the ones who are already with boots on the ground doing the work. And they're already engaged with the community, and they may already be offering something that's similar, or they may be providing a service that's similar. And at minimum, they probably have individuals who might be able to serve already as sort of a more ready community mental health navigator, a community mental health worker, or a promotora. So, really trying to look at the resources available to you in terms of a community-based organization. Really trying to build with community capacity building. That's something that we want to focus on long term. So it's not just about capacity building specifically for the agency or specifically for an entity that provides services, but really trying to build community capacity to promote mental wellness themselves. And so these cultural brokering programs and strategies can be really effective in terms of implementing, it can be really effective in doing so. And so thinking about that in terms of the implementation of a program can be important. And then supporting flexible lines of funding. As I've identified, some of these promotores programs, whether it's the cultural ally program at Stark County, whether it's a more, traditional, we call them cultural broker program, they can have different tasks or responsibilities, and they may serve different purposes. And so really supporting flexible lines of funding, because not every program is equal, depending on the community's mental health needs, depending on the agencies that they're working with, the job or the day-to-day task of that provider or that community mental health worker may look different. And so really trying to support flexible lines of funding, so different parts or different domains of their job can be covered. So I really tried to save enough time to have questions and make sure that we could have a discussion. I think sometimes that's the more fruitful part of these presentations. So I'm done with content, but I'm happy to take questions and things. I also have contact information, so feel free to reach out to me if you have any questions about the content today. Again, my hope was to give you a general understanding of how cultural brokering works, and then give you some really concrete examples of how we're doing some of that work here in Ohio. And certainly maybe, it might be of value to you in your state if you're outside of Ohio as well. But feel free to reach out to me if you have any questions.
Thank you very much, Marty. This was an amazing presentation. We have several questions. So the first one is, how can Latinx college students, especially in the pre-health professions, social workers, etc., get involved as promotoras de salud?
That was a great question. I think that's a great idea too. So, as we think about the behavioral health workforce, we need to be pushing for younger and younger, to really touch younger and younger audiences. And so I love the idea of basically, college students or, college students sort of serving in these roles, or even trying to, undergo the mental health first aid training and provide that, serve in that role, if you will. Because the more individuals earlier on in their education that are learning some of these skills and that are engaged in some of these initiatives, the higher the chance that we're going to have to expand that behavioral health workforce. So even if you're going, even if you're a college student who's interested in becoming a pediatrician or a primary care provider, having that mental health experience is going to serve you so well into going into that profession. It's going to increase your skill development. It's going to make you a better provider once you enter your health science sort of education curriculum. And so getting more college students to really try and fill these roles, or really try and engage in some of this programming, is actually really important. I think the best thing that we can do is expand the messaging, like say that these are really good opportunities that are available, making sure that college students know that these positions and that these trainings are available and accessible. Like I said, mental health first aid is available to anyone and everyone. Getting college students who can serve in promotoras roles, especially if they are bilingual, would be incredibly valuable and incredibly important. I think public health really sort of, has taken a lot of the lead in terms of the promotoras model as well, in terms of disseminating public health messaging. So even public health students or college students who might be interested, having that experience and getting them involved, I think earlier on is important. I think we can also do a good job, or a better job, sorry, not a good job, I think we can do a better job of sharing some of this information even at the high school level, as individuals are starting to make their, choices or selections about college and college options, or post high school options, post secondary options. So I think, really trying to target education settings earlier in their educational trajectory is going to be really important in terms of building our behavioral workforce, or just building this frontline capacity that I talked about. So definitely getting the message out, sharing these opportunities, and being more intentional about it. I think that's something that's missing, is that we just need to be very intentional about going into colleges, going into high schools, and sharing some of this information, and really promoting mental health strategies and mental health wellness at earlier educational levels.
Thank you very much, Dr. Sampilo. The next question is, are all of the promotores and ally models evidence-based?
Yes, great question. So yes, they are evidence-based. So as I just mentioned in the last answer, it really sort of evolved in the medical field. So public health and medicine really sort of developed these models to try and address issues that were of a public health nature. So like health messaging, trying to live a healthier lifestyle, trying to make sure that people are getting vaccinations, but then also in medicine in terms of reducing chronic disease burden. So trying to target things like healthy weight, diabetes. Those were really sort of the first areas that these models sort of emerged from. And then with every different iteration in terms of the target issue that they're targeting, the evidence base for the promotoras, or the evidence base for the community health worker, evolves from there. So the model itself is evidence-based, but then within their specific training area, they're pulling from the evidence for that particular specialty field. So for example, if it was diabetes, it's evidence-based diabetes education that they're delivering. It's evidence-based diabetes intervention, health interventions that they're delivering on the community level. So all of these models are based in evidence. It just may shift depending on what the specific topic or what the specific area of training is that the promotora will be focused on. For behavioral health, it would be evidence-based regarding behavioral health education, mental health education. So some of that public health messaging around mental wellness, health promotion, mental health promotion, and prevention.
Thank you very much. The next question is, are there mental health first aid instructors in Ohio teaching the curriculum in Spanish?
That is a great question. So definitely there are mental health first aiders in general in Ohio. There are much fewer mental health first aiders who have completed the Spanish curriculum. We do have a few, and we do have individuals who were actively trying to recruit more to be able to do that. There's a little bit of a lull right now because of the fact that the Spanish curriculum was trained or delivered in person. It was designed, well, all of the mental health first aid training was designed and delivered in English to be delivered in person. There was also a Spanish curriculum that could be trained in person. Because of the pandemic, they've had to shift all of those trainings to virtual training. So the trainings are done via Zoom. So they have not yet created they have not translated the Spanish in-person curriculum to a virtual version yet. They're in the process of doing that. My understanding is it should be ready in the next few months. So they will launch the virtual training version of the Spanish curriculum, but it's not yet available. But prior to the pandemic, there were individuals being trained with the Spanish curriculum. It's something that we definitely are actively wanting to recruit. We want to build up that capacity. And so, you know, if anyone is interested and is bilingual and is interested particularly in the Spanish curriculum, you know, please, you know, go to that website and definitely share that website with individuals who you think might be interested, because definitely there's an interest and not only a vested interest, but also, you know, a big sort of push to try and get more individuals trained with that Spanish curriculum.
Perfect. We have another question that is like specific from Ohio. So how we can open an agency that serves the Hispanic community in Akron to give those services that you are talking about?
So if I understand the question correctly, it sounds like the participant is asking, or the attendee is asking, you know, what are some ways that we can maybe create more mental health services in the Akron area? So one of the things that I would do is sort of have the you know, potentially reach out to your local board in Akron, so your mental health and recovery board, to try and see what are the behavioral health agencies in the Akron area who provide services and who can provide services to the Hispanic and Latino community. That's where I would start to try and get a sense of who's involved, because one of the things that I think we've discovered with the Community Mental Health Navigator pilot is there still is, I think, just some lack of awareness or lack of knowledge regarding resources that are available. I don't know that we have enough resources, though we definitely don't, but I think there are sometimes resources that we're not aware of. So, and that's something that I think that's where we would start, is finding out what is available in your area, having more awareness of what are the options that are currently available. If there are not options or good options available, then potentially, you know, going to the mental health board or a local agency who provides mental health services and advocating for a system like this, where there's a cultural broker, because in creating a mental health system or creating a mental health agency from the ground up is incredibly hard work, and it takes incredible resources and incredible time. But utilizing what's currently available and potentially just advocating for some of these programs to try and get buy-in from those systems, because again, there's a lot of value for the agencies themselves to incorporate these systems or these programs into their services. There's a lot of business value to it, but then there's just a lot of just organizational and community standing value as well. And so that's what I would do, is I would recommend sort of getting a lay of the land in terms of what resources are available, and then also potentially going to some of the agencies, or potentially going to a board of some sort, or a behavioral health authority if you're in a different state, and advocating for some of these tools and programs, because I do think it can help. It doesn't do anything but help and really improve an agency's service delivery. So advocating for an adoption or getting some buy-in for adopting some of these programs is going to be pretty critical.
The next is more like a comment, and it said, we are just beginning to talk within our community how we can help the Latino community to get the help they need in all areas. This model looks like it can work within our desire to help and wonder where we can get more information. We live in Clark County.
Clark County, awesome. Thank you for your comment, definitely. So there's a couple different places that I would potentially go. One is you can always email me and I can try and connect you with some additional resources on some of these models, depending on which ones you're interested in or which ones seem like they might fit best. But the other thing is that we really are trying to work on bringing some trainings to Ohio in this area of promotores de salud mental. And so just sort of be on the lookout because that's going to be something we're actively working on. That's sort of the next step after this presentation is to try and get some additional training opportunities available to the Ohio community regarding that specific model, the promotores de salud mental. So definitely, if you're interested in that potential training down the road, and again, we're working on it, so it won't be like a long time, but we're definitely, it's on our agenda as a way to try and get more training, more education around these models. So definitely reach out to me. You can contact me via email, and I will definitely try and make sure that you stay sort of in the loop with the information and resources available.
Great. The next question is, are there best practices for supporting community members who are seeking non-traditional mental health care outside of cultural broker or promotores model?
That's a great question. I don't know if I actually know the answer to that. That is a great question. I will actually do a little bit more research on that. I would say that generally speaking, we try and route individuals to some of these evidence-based models, but certainly there's value in sort of non-traditional models as well. I don't know of anything in particular around how do we help individuals sort of connect to those more non-traditional models. But certainly I think one of the things that you can do is, or one of the ways that a cultural broker can operate is to help maybe, provide some of that education, not only to, patients and families, but then also to providers. So providers like myself, for example, are more knowledgeable about what are some of the non-traditional options, what are some of the non-traditional ways that we can, help individuals, have their needs met, who potentially, may not be ready to enter the traditional mental health care system. And so part of that may be, just an educational piece, but a cultural broker who's likely to be very familiar with some of those options and likely to be able to kind of bridge that gap even can be really helpful. I think, the other thing that I think is we always want to, provide the information that we have at our disposal regarding behavioral health, and then offer options and making sure that we're offering, options across the board to individuals who might be seeking help, because as you mentioned, your question I think is very valid. Not everyone is ready necessarily to enter the formal behavioral health care system. Like I said, there's a lot of sort of historical and contemporary distrust or mistrust of the system for a lot of different reasons. And so there may be, really a lot of different reasons for that hesitation or that reluctance. And so really trying to respond in a culturally sensitive way to, okay, where are some other ways that we can get you some assistance? Maybe we're not ready for the traditional healthcare, mental health care system, but could we link you up with a cultural broker or a promotore de salud mental to start? Could we, help you get case management services that might be the first foray into your into the mental health care system? I would say that the other thing that I would definitely do is rely on community-based organizations. So for example, like Su Casa, Our Lady of Guadalupe Center, there's Adelante in Toledo, El Centro in Lorain County. These organizations do fantastic work, and they are the trusted organizations in their communities. So if an individual is maybe not ready, to try and seek out behavioral health care in a traditional community mental health agency or a hospital setting or a clinic setting, I would definitely connect them with their local community-based organization that they trust, because they're going to be able to help them connect to the types of services and types of options that would be more comfortable for that individual. So definitely rely on those organizations. I think they serve such an invaluable role in the community. They serve so many functions, so many roles. I'm amazed at all of the work that they do, just on a day-to-day level. I'm always amazed by everything that they do. And they really are out there working for the benefit of the Hispanic and Latino community. And I know there's other organizations that I'm missing, but certainly I think relying on them to help be a bridge or help connect that individual, maybe as the next step as well, would be important.
We have 2 more questions. The next one is, what roles can non-Latinx folks play in creating more inclusive mental health and behavioral health systems for Latinx populations?
Awesome. Fantastic question. So I definitely think there's a huge role. One is definitely, I think, advocating at your agency or your system, whether it's a school system or, what have you, just advocating for practices and standards for culturally and linguistically appropriate services. So one of the things that I have mentioned on other presentations that I've done in this space is really trying to be very intentional about how you implement culturally and linguistically appropriate practices. And so rather than treating things, and historically, I think this is just something that happens, is sometimes we treat cultural and linguistic competence as a checkbox. And I think we need to move away from that and really focus on how are we intentionally addressing gaps, how are we intentionally creating inclusive environments, have those strategies outlined, and then be accountable to them. So I always recommend agencies have a behavioral health equity, like strategic plan, or a cultural competency strategic plan. It's a plan that you outline, you're intentional in outlining your strategies, how you're going to implement them, when you're going to implement them, how do you know if they're working. Really having a strategic plan specifically related to issues of cultural competence and cultural proficiency, because that will create more accountability in terms of being more inclusive and establishing more of a diverse and inclusive environment. I think the other thing is really amplifying the voices of the minoritized and marginalized communities. And so whether that's making sure that there's representation at your agency, maybe you're working with a community-based organization and they're being brought into the table in terms of gaining their perspectives. They're being brought into the table to help make decisions or at least give their perspective on things. Making sure that you have representation from the communities that you're intending to serve. At the end of the day, I always include in my presentations this idea of nothing about us without us. So there really should not be any programs, initiatives, efforts that are put into place without the consensus and the buy-in of the community that you're intending to serve. So really, if you can sort of embody that whole nothing about us without us sort of idea, I think that's going to really go a long way to helping agencies, systems be more inclusive and really commit to more equitable care for the Hispanic and Latino population.
So we have a comment on, we at Adelante are happy to share our experience with getting this program started. And she said the phone number is 419-244-8440, Adelante Toledo.
Awesome. That must be Sabina. Is that Sabina?
Yes, Sabina.
Sabina's fantastic. Adelante is fantastic. So definitely she was not part of the OMAS pilot, but she is also implementing a community mental health navigator program, I believe in concert with her local mental health and recovery addiction board. And so they have a partnership to implement this navigator program. And so she's also a great resource in how to get something like this launched and has, I'm sure, some fantastic strategies and tips that she would like to, she would be willing and able to share as well.
Great. So what are some barriers in recruiting cultural brokers from the community, and what has been done to remedy this?
That's a great question. So some of the barriers that I know of from the literature and just from anecdotally as well. So from the literature, I know sometimes that there's a barrier in terms of trying to get individuals who represent those communities to work with some of the systems in that cultural broker fashion. So they may have they may also have certain beliefs about the system. And so you sort of have to navigate those assumptions or those beliefs about the system based on their experiences. I think the other thing that has been shown is that really treating the potential cultural broker as an expert. And I think sometimes that's missing from the equation. And so sometimes cultural brokers feel that their expertise is not valued the way it should be, right? So we sort of mentioned that cultural brokers have expertise in two buckets. One is their community and their culture. The other is, healthcare system in terms of how they navigate it. And I think sometimes the experience has been that their expertise that they bring to the table isn't valued or acknowledged the way that it should be in that type of cultural broker program. So really trying to emphasize what that expert role for them is and how it serves. And then I think the other barrier has been role definition. And so what does the cultural broker do? What is their job, function, responsibility? As I mentioned, that they can serve a lot of different roles and functions, and that's okay as long as that's identified and that role is identified. I think sometimes cultural brokers are expected to do a lot more than what they necessarily were hired to do or what they were employed to do, and sometimes that can cause cultural brokers to leave their positions. At the end of the day, cultural brokers generally care a ton about their community, and so they're reluctant to not help and serve their community. But sometimes I think there have been instances where that's not exploited, but sort of overlooked as sort of the burden on the cultural broker, and they can be overburdened pretty easily. So I think, role definition, making sure they have their adequate supports as well, and their expertise is acknowledged and valued are all critical components of sustaining a cultural broker program. In terms of what is being done, I think there's a lot of more training being done at the outset, not just for the individual who's going to be the cultural broker, but then also the agency or the entities that are going to be working with the cultural broker. They need training too in how to navigate or work with the cultural broker. So it's not just a one-sided training that needs to happen, but the agencies themselves have to be ready for the cultural brokering or the community mental health navigator or the cultural ally. They also have to receive some training so that they can increase their readiness to work successfully and effectively with that cultural broker. So I think more training at the outset has been done to try and remedy that issue as well.
And I think we have time for the last one. Are you finding local ADM boards finding ways to help with providing services to clients who have no documentation?
That is a great question and definitely one that continues to be a challenge. So I would say that there are limitations, and unfortunately, I don't have a good answer for addressing those limitations. There are, I think, Adams boards who are very comprehensive, I think, in terms of being in terms of identifying the limits of what some of their agencies can provide. But at the end of the day, there is still very much a shortage in terms of agencies or providers who can provide services to individuals who are undocumented. And so that continues to be a challenge. I know that they are trying, at least as far as I know, there's a couple of different boards, a couple of different entities that I know who I've spoken with who are trying to come up with like innovative ways to create, different ways to provide services to individuals who are undocumented. It may not be one-to-one service, but maybe it's community outreach through education. It's community outreach through, brief intervention, using some of these cultural broker models because there's not necessarily, an entry into the behavioral health care system. But, to your question, which is always a very valid question, there's no easy answer, unfortunately. There's definitely a significant barrier for most entities to be able to provide services to individuals who may not have documentation. And that continues to be something that we need to try and address at a policy level, but then also at a policy level for sure. But then also potentially investment in some of these more going out into the community programs because it may not necessarily require entry into a healthcare system for the purposes of having to have, insurance or documentation otherwise.
Amazing. Thank you very much, Dr. Sampilo. I think like this presentation was really engaging. It was so much information, so helpful. And for taking like almost 30 minutes to answer question, I think that's an awesome approach. So thank you everyone for being here with us. Remember, you will receive an email with our evaluation. Please answer that one, and also you're gonna receive a certification of participation. So again, thank you very much, Dr. Sampilo, and thank you everyone.
Thank you,
Bye.
everyone.